Here's something that might surprise you about obesity. It is not limited to rich countries. In fact, people in poor countries are getting fatter faster than people in wealthier countries. The number of obese and overweight people in the developing world has quadrupled since 1980. Almost 1 billion people in developing countries are now overweight. That's up from 250 million 3 decades ago. Our health specialist, Dr. Ali Zentner, joins me now to go through these numbers. What's the story behind them?
So this was a study done through the World Health Institute that looked, for example, at what are the rates of obesity in the developing world and also in developed countries. And what it found was essentially what you've mentioned, a quadrupling of numbers. I think the concerning thing that it suggests to me is that, one, you're looking at a much higher percentage of population. You're now looking at a disease that is essentially global. You're looking at a disease that affects both poorer countries and wealthier ones. And when we think about health implications about obesity, we worry because diabetes and hypertension and heart disease are diseases that need wealthy countries to deal with them. And so now this is something that developing countries are facing in terms of their own public health.
You know, some of the biggest increases are in countries where people have very low incomes, where some people don't have enough food to eat. So this seems counterintuitive.
I think what we used to think, Donna, was that it was a calories in, calories out phenomenon. And it's not just the sort of amount of food you're eating. This isn't a disease of the rich. In fact, if we look in Canada and the U.S., we're finding that very much this is a disease that affects lower socioeconomic incomes.
So it's not quantity, it's the quality.
It's quality of calories. We're looking at high sugar, high fat, cheap calories, so to speak. That's very much contributing here.
And what does this all mean for the world's health and Canada's health?
You know, I think, as I mentioned, the Global Health Initiative actually looked at chronic disease as one of the biggest contributors with regards to future health. And what we're going to see is a shift in terms of what affects the global population. Things like chronic diseases are going to become a bigger issue. As Canadians, I'm comforted by the fact, you know, the optimist in me, that now we have more stakeholders at the table. And what may work, for example, for population health in India, we might learn lessons here in Canada that we can apply at home.
The more we talk about it, the more an issue we make it, the more likely we're going to tackle it.
Absolutely. I think when the world's discussing it, then at home we had best be doing so as well.
All right, Dr. Ali Zentner, thanks once again.
Thank you.